Hello everyone. So last week we have already talked about the first two classifications of the structural disease. We have the congenital and hereditary diseases as well as the inflammatory diseases na merong tatlong type. We have infective, toxic, and allergic diseases. So for this afternoon, what we will be talking about is the cardinal signs of acute inflammation as well as the other classifications of the diseases. So first, what is inflammation? Again, inflammation or the inflammatory reaction is a generalized pathologic process that is non-specific to the agent causing the injury. Okay? So, ang purpose ni inflammation is to localize the injurious agent and prepare for subsequent repair and healing of the injured tissues. So, what are those four cardinal signs of acute inflammation? We have here red skin, swelling, heat, and pain. So, paano ba sila tumatrabaho? Paano ba sila nagmamanifest kapag may acute inflammation? So, for example, you were walking on your kitchen and hindi mo napansin na napatama ka sa corner ng lamesa ninyo. So, syempre masakit. For example, na napatama, hita. So, lakad ka, nakaultaw yung corner ng lamesa. Napatama ka. So, aray, ang sakit. Okay? So, mangyayari doon, yung site na natamaan na yun, the capillaries will become dilated. Okay? And it will increase the blood flow together with the leukocytes. Dala-dala ni blood yung leukocytes. So, sino ba si leukocytes? Ano bang purpose nun? So, these are responsible for cellular necrosis. So, napatama yung part ng hita mo, dapat mamatay yung cell na natamaan or yung tissue na natamaan para hindi na siya kumalat pa, para hindi na siya mag-radiate pa. Okay? So, capillaries become dilated, the blood flow will increase together with the leukocytes para magkaroon ng cellular necrosis. This blood flow or this increase in blood flow can result into a heating sensation. Kaya meron tayong calor, okay? Or tinatawag nating heat, okay? So, syempre, namatay yung part or yung tissue na napatama. Anong lalabas doon? It could have a bruise or contusion. Or it could also have a red skin, reddening of the skin, or what we call rubor, okay? So, during that, yung part na napatama sa inyo, or yung part na na-injured, it will have pain. Okay? It will swell up and it will have pain. You can feel pain on that particular area. So, anong trabaho naman ni pain or ni dolor? Siyempre, as a person, alam mo may masakit sa'yo. Anong kailangan mong gawin? You have to protect that. Ipoprotect mo na siya na hindi mo na maipatama pa sa susunod. Kasi sino ba namang tao yung alam mo masakit, tas ipapatama mo pa? Di ba martir na yung mga ganon? Pero as a normal person, hindi ka martir. Masakit yung parting yun. Bakit mo pa ipapatama? Di ba hindi na? You have to protect it. So, syempre, lakad-lakad ka, alam mo masakit, hindi mo na siya itatama. Hindi mo na siya iuumpog pa. So, during that time na pinoprotect mo yung part na na-injured, our cells or our tissue will undergo repair. Okay? So, kapag nag-repair yung mga tissue na yon, gagaling siya. Okay? So, that's the power of an inflammation or the inflammatory reaction ng body ng katawan ng tao. You can feel pain para mabigyan mo ng time yung katawan mo na mag-heal. Okay? So, for example, iniwan ka ng jowa mo, just feel the pain. Kasi sa susunod, mas mag-glow up ka. Okay? So, ganun yung inflammation. Cardinal signs of inflammation. Alright? So, next classification is the degenerative disease. So, common nating iniisip kapag degenerative disease, ang tinatamaan lang niya is matatanda or elderly persons. So, ano ba yung degenerative diseases? These are caused by the deterioration of the body. unti-unting nasisira yung parts ng katawan ng tao. Usually nakikita siya sa bone. Unti-unting nadidemineralize. Unti-unting nawawala ng calcium yung buto. So, sino bang nakaka-experience ng mga ganon? Elderly lang naman. Pero again, I repeat, degenerative diseases are not just for elderly people. Kasi, meron tayong mga degenerative diseases na ang cause niya is traumatic injury. For example, yung pasyente nahulog, napatama, likuran. Or let's say, dun sa lumbar area na niya mismo, napadulas siya. So, upon radiographing the lumbar area, wala naman kayo nakitang subluxation, wala kayo nakitang dislocation, and even fracture, wala kayo nakita. Pero, ang makikita ni doctor, arthritic changes. Okay? So, nagkaroon ng arthritic changes, nagkaroon ng degenerative disease because of trauma. Again, hindi lang matatanda ang may degenerative diseases. So, for example, yung patient na yun, nasa mid-20s lang. So, degenerative diseases can be caused by a traumatic injury, or it may develop following a traumatic injury. So, the process of aging results from the gradual maturation of physiologic processes that reach a peak and then gradually fade to a point at which the body can no longer to survive. So, another factor that affects the degenerative disease could be hereditary or the diet and environmental factors. Again, hindi lang lahat na elderly ang nakaka-experience ng degenerative diseases. Meron ding mga bata. And yung mga factor na kakaapekto nito could be hereditary, the diet, or the environmental. So, example for degenerative disease is osteoarthritis. So, normally, ang knee joint, maganda yung cartilage. Smooth siya. Kapag inilakad, hindi magani. Kapag nag-osteoarthritis, this cartilage will become erosed or nagkakaroon ng erosion ng cartilage. Nasisira yung cartilage. And even the bone itself will have spurring. Pag sinabi natin spurring, there will be bony outgrowths, and this is painful, extremely painful for the patient, especially in the knee area. Kasi yung knee ng tao, it help to weight or to bear the weight of the patient or of the people. So again, osteoarthritis is an example of degenerative disease, as well as atherosclerosis and osteoporosis. Okay? So next is the metabolic disease. So metabolism is the sum of all physical and chemical processes in the body. So these diseases are caused by a disturbance of the normal physiologic function of the body. So ano ba yung mga naaapektuhan na metabolic disease? Usually, ang nag-maintain ng balance sa mga physiologic functions ng katawan ng tao is the endocrine glands. So what are the major endocrine glands? We have pituitary, thyroid, parathyroid, adrenal glands, pancreatic islets, ovaries, and testes. So those are the major endocrine glands that help or that keep the balances inside our body or the physiologic function. It maintains the physiologic function inside the body's patient or the patient's body. So, an example for this is dehydration. So, syempre may normal lang tayong dapat na sinusundod for fluid balance sa katawan ng tao. Kapag nagkaroon niya ng disturbance, or let's say fluid imbalances, pwede tayo magkaroon ng dehydration. Okay? So, that is an example of metabolic disease. Dehydration is the most common disturbance of fluid imbalance. So next for metabolic disease is traumatic diseases. So these are usually caused by an external mechanical force. Okay? This may result from mechanical forces such as crushing or twisting of a body part or from the effects of ionizing radiation on the human body. So, mga example ng traumatic disease, paano natin malalaman na may traumatic disease yung patient? Siyempre, kapag na-fracture yung bone, nagkaroon ng sugat, nagkaroon ng bruise or ng contusion. So, that is an example of traumatic disease. These are from an external force or mechanical force on the external surface of the body.